Hello, my name is Samuel Camacho. I am currently 50 years old. I work as a disease intervention specialist with my local health department. My medical depth story starts when I was 45 years old. I was working freelance as a medical interpreter and I was covered by a marketplace plan. I chose Oscar because my PCP, emergency room, and urgent care were all in network. My medications and preventive care were also covered twice a year as well. I moved to the United States in 2012. My background is in microbiology and I am a medical professional postgraduately from the Dominican Republic. I have learned how the healthcare system works here in the United States and how it differs from other countries. My challenge started in 2018 to 19 when I arrived at the emergency room with a severe left quadrant plane that traveled to my groin and lower back. I could not sit still. I was diagnosed with renal calculi in both kidneys, as seen on an x-ray. The doctor recommended consulting with a urologist and managing the pain in the meantime. The urologist found out that the calculi in both kidneys were too large to pass through urine, and I needed a procedure called lithotripsy. This was an ambulatory procedure under general anesthesia where they removed the calculi or placed a stent for removal in a week. I was scheduled and placed on a waiting list to be cleared by the internal medicine team, and the day I was scheduled for the procedure, I was given a series of documents to sign that included financial responsibilities. I was insured, so I was not worried and was told that I did not need to pay anything at the moment. After the procedure was done, I was sent home, and the same procedure was done the following week with the other kidney to free my flow and remove the calculi. After several visits to the urologist for follow-ups, removal of catheter by uroscope, and other procedures, I was calculi-free. A month later, I received my first bill of several $1,000s that I had accumulated. I was told that the insurance would cover the procedure, but what they did not tell me was there was a $6,000 deductible that needed to be matched in order to get the rest covered. The moment I tried to establish a payment plan with the hospital, they said they no longer made payment plans with patients. It was done by a third-party program called Access One. Basically, they sold my debt to a third party and started with a 4% interest rate if paid in full at the allotted time. I started making payments, but with time, I acquired an IRS debt because of my subcontract work, and I started having financial issues that limited my ability to pay such a big price tag. The only choice I had was to find a lawyer to help me settle the debt and work on a deal. To this day, it's still being debated, and I have not received a settlement or been able to close this chapter of my health and finances.